Local anesthetic is a medication that causes reversible absence of pain sensation. Although other senses are often affected as well, when it is used on specific nerve pathways, or what we call as local anesthetic nerve block, paralysis or loss of muscle power can be achieved as well. The use of local anesthetics dates back at least to the discovery of cocaine, present in the coca plant, followed by the development of benzocaine in the late 19th century. Procaine was developed in 1906, and drugs such as lidocaine were developed later in the 20th century. There are 4 local anesthetic drugs, and these are esters, amides, ketone type, and other chemicals that act like local anesthetics. There are 5 esters drugs, and these are: number 1, procaine. Another term for this is novocaine. Number 2, propoxycaine. Number 3, tetracaine or pontocaine. Number 4, benzocaine. And number 5, cocaine. There are 9 examples of amides, and these are lidocaine or xylocaine, mepivacaine or carbocaine, prilocaine or citanest, bupivacaine or marcaine, etidocaine or duranest, dibocaine, articaine or ultracaine, ropivacaine or naropin, and levobupivacaine or chirocaine. Example of ketone type is diclonine. Other chemicals that act like local anesthetics are: number 1, H1 antihistamine such as diphenylhydramine. Number 2, saxitoxin. And number 3, tetrodotoxin. There are 2 mechanisms of actions of local anesthetics. Number 1, block sodium channels in the nerve membrane, and number 2, prevent depolarizations of the nerve. Pharmacokinetics and actions of local anesthetics. For better solubility, local anesthetics are marketed as the salts of strong acids, such as hydrochloric acid. The pH of the solution in the cartridge is acidic. Injection of the drug places the drug in a solution of higher pH because of the buffers in the body. A higher percentage of the drug becomes non-charged and can more readily penetrate through lipid barriers and into nerves. The higher the lipid solubility, the more potent and long-lasting the drug. The lower the protein kinase, the faster the onset of action of the drug. At low pH in tissues, anesthesia becomes more difficult to attain because of the presence of higher percentage of the charged form of the drug. Properties of some local anesthetic drugs like procaine, mepivacaine, prilocaine, lidocaine, and bupivacaine varies on relative lipid solubility, anesthetic potency, and duration of anesthesia. Bupivacaine has the greater number of plus signs as compared with lidocaine that has substantial positive sign, while mepivacaine and prilocaine moderately have only 2 positive signs, and procaine has minimum positive sign to relative lipid solubility, anesthetic potency, and duration of anesthesia. Bupivacaine has moderate pKa, or what we call as protein kinase, and rate of onset, while mepivacaine, prilocaine, and lidocaine have minimum protein kinase and fast rate of onset. Procaine has the slower rate of onset but higher protein kinase. Cardiovascular effects and receptor preferences of 2 common vasoconstrictors used in dentistry are epinephrine and levonorephrine. The adrenergic receptor preferences for epinephrine are alpha-1, alpha-2, beta-1, and beta-2. And the effects are increased heart rate and blood pressure, while the adrenergic receptor preference of levonorephrine are alpha-1 and alpha-2, and the effect is increased blood pressure. Metabolism of esters occurs primarily in the plasma, whereas amides are metabolized in the liver. Amides, such as lidocaine, are metabolized in the liver by 3 types of reactions. Number 1, the alkylation of amino terminus. The alkylation is a chemical process through which alkyl groups are removed from a given compound. Number 2, hydrolysis of amide bond. Hydrolysis is the chemical breakdown of a compound due to reaction with water. And number 3, hydroxylation of aromatic ring. Hydroxylation is the first step in the oxidative degradation of organic compounds in air. The most abundant urinary metabolite of lidocaine is 4-hydroxysilidine. Metabolism of lidocaine is rapid. Terminal half-life equals 2 hours. Relative sensitivity of nerve fibers to local anesthetics. These are arranged in decreasing order of sensitivity: pain, temperature, touch, pressure, and motor. There are 2 adverse effects of local anesthetics. Number 1, central nervous system effects, and this includes lightheadedness, dizziness, muscle twitching, convulsions, and respiratory arrest. Number 2 is cardiac effects, some cardiac depression, but also specific antiarrhythmic effects.